The first question, what's the lowest age someone is invited to attend for a cervical screen or a smear test? A, B, or C? The answer is C, 25 years old. And women are invited to attend for cervical screening, their smear test, every 3 years between 25 and 49, and every 5 years between 50 and 64. So the next question is between gender and cervical screening. Men can attend for a cervical screen or a smear test. Is that true or false? The answer is true. Men can attend for a cervical screen. So if you're a trans man, you could attend. The important thing to know is that only people who are registered as female with their GP will be invited to attend. So if you're a trans man, that is that you were assigned female at birth, but have now transitioned to a male and are now registered as male with your GP, you may not be invited. Okay, so it's important to check out how you are now registered. The rule of thumb is, if you have a cervix, then cervical screening is for you. Women who identify as LGBT don't need to attend for screening. And is that true, false, or unsure? So it is false. Women who identify as lesbian or women who have sex with other women still need to attend for regular cervical screens. In times gone by, I think some lesbian women may have been ill-advised by health workers that they don't need to attend for screening because they don't have sex with men, or maybe they were told by other lesbians that they don't need to be screened, but they do. Women who have sex with other women can still pass on the HPV virus, which is the #1 cause of cervical cancer in women. People don't need to attend for screening if they're not yet sexually active. So is that true or false? Yeah, it's false. Yeah, you do still need to attend for screening, whether you're sexually active or not. It's true that you're at a lower risk of cervical cancer if you're not active, because most HPV infections are sexually transmitted, but again, it's low risk, not no risk. So therefore, women still need to attend for their cervical screening if they're of cervical screening age and are not yet sexually active. People with learning disabilities, so a learning disability, not a physical disability, a learning disability, do not need to attend for cervical screening. Yes, it's false. But I'd take unsure as well on that one. Oddly enough, it is false, but I would take unsure. They do need to attend for cervical screening, and in most cases, this will be a conversation that they either themselves will have or their carers need to have with their GP about whether or not it's viable and that they have a need to attend. It's a discussion based very much on an individual basis about their own circumstances. Recent studies have shown figures as low as 1 in 4 or 25% of women with a learning disability are attending for their cervical screen, as opposed to 73% of the general population. So the next question, how many different types of HPV are there? A, B, C, or D? So the answer is D. There are over 100 types of HPV, but only around 13 or 14 of them are considered high risk. The next question is, what % of cervical cancers are caused by an HPV infection? So you've got 30%, 50%, 75%, or over 99%. The answer is D. It's over 99%. It's actually between 99.7 and 99.8. 99.8 is the figure that's listed on Cancer Research UK website. Cervical screening can prevent people from getting cancer in the first place. True, false, or unsure? It's true. Cervical screening protects against cervical cancer. So screening spots those changes before they turn cancerous. Our key messages are, if it's unusual for you, see your GP. Early detection saves lives. Cancer screening saves lives.